AYA is defined by the National Cancer Institute as any individual between the age of 15 and 39 at the time of cancer diagnosis. The reason this particular age group is carved out because it represents a gap population. This age group is very different than younger children and older adults, and the ways in which they're different are troublesome. Overall, as a group, their survival is actually the poorest.
Hey.
Hi.
How's it going?
Good. How are you?
Good. How's your son doing?
He's doing good, getting bigger and bigger. I had really bad back pain and a little bit of a fever, and I was holding off going to the doctor, but one day it was so bad, Mom was like, go to the doctor and see what they tell you. After 2 days of lab work and a bone marrow biopsy, they told me I had leukemia. I was devastated, crying my eyes out, just thinking about Matthew, thinking that I was gonna die.
In Rebecca's particular case, she does have a classically pediatric type cancer. It's hard for young adults like Rebecca to figure out, where do I go for care? Because they tend to feel out of place. Children's cancer centers look like they're designed for young kids, and adult cancer centers look like they're for old people.
Can you get up kneeling? You can hold on to it if you need to. There you go. Can you grab onto that? Okay, both hands, and then let me have you pull across your body.
So I was limping pretty bad. I would feel a sharp pain on my knee. I didn't really know what it was. So my mom decided to take me to a primary doctor. We got x-rays. So they called my mom back and said that there was something abnormal, that they should rush me to the hospital to an emergency room. Dr. Grimes was the one that diagnosed me with osteosarcoma. But I ended up deciding to do the whole surgery of removing my leg, starting the new thing with the prosthetic. I really didn't want to keep doing surgeries.
This age in between, they're the most underrepresented in clinical trials. So it means that we have less information about the cancers that occur in this age group and how they respond to treatment. And that age group of patients has less access to medications that may only be available through a clinical trial.
I wanted to go back to school. Back then I was doing a paralegal studies, so that didn't happen. I wanted to start working again as well, but with treatment, it wasn't possible. People tell you all the time, like, I understand what you're going through. I know how you feel, like, but unless you've gone through it, like, you don't really know. And we know you guys have like good intentions.
Adolescents and young adults have very unique psychosocial challenges when compared to younger children and older adults. We really wanted to put in place individuals that were only focused on this population and that had particular skills and expertise in caring for AYAs and the unique challenges and problems that this age group faces. So we actually partnered with an incredible organization called Teen Cancer America that is supporting the early development of our AYA cancer program. We are using some of the funds from Teen Cancer America to hire 2 AYA specialized positions. One is an AYA social worker, and the second is an AYA nurse navigator. Teen Cancer America has provided resources for an AYA lounge. This is a place where young cancer patients can talk with one another and feel less isolated. I feel like we're doing something right when we can tell a patient like Rebecca, after your long fight, you get to celebrate with a special bell ringing ceremony with your family because your cancer is finally in remission. And I hope that 5 and 10 years from now, we look back and see the establishment of this program as a game changer for the South Texas community, and that survival has actually improved.